Once again, we are back on Soch Tea Talk, Train of and Thought with a series of an episode with Dr. Chris Souza. We have seen his interesting journey as far as the medicines which is concerned, his passion which are concerned. And in our last episode, we had a discussion with Sir about his head and neck cancer care during the pandemic. Now in this episode, we are going to take up the challenges in pandemic. Sir, once again, welcome to Tea Talk Soch. Can you throw some light about your book which you have written in the challenges in the pandemic?
Thank you, sir. Well, I'd like to say that this book was written in real first-hand experience. Now, as I spoke to many other consultants who were involved in this, I realized that there was a lot of genuine confusion. There were any number of webinars and things, and I could hear people arguing non-stop, but there was no clarity and no light at the end of the tunnel. So I said that I need to discuss the challenges that we face when treating patients and how we should treat them and what we should do. So I wrote to many people all over the world, and the very famous Dr. Paul Marik, Dr. Joseph Varon, and Dr. Jose Iglesias from the US agreed to collaborate with me on this book. I'll share an experience. In May 2020, I was doing a procedure on a patient to help that patient to breathe. The patient had very bad COVID-19. And unfortunately, the intensivist removed the tube that was in the patient's mouth to help the patient to breathe at the wrong time. And I got a blast of infected material between my visor and my mask. Of course, I was frightened. Of course, I was apprehensive. But I finished the procedure safely for the patient. Then I went out into the changing room. I had a very good bath, but I thought that I would suffer from COVID-19 myself. I took everything under the sun. I took HCQs, ivermectin, you name it, and I took it. And I waited to see if I would get symptoms. Fortunately, nothing happened. So then I said, I think God must really be looking after me. So I said that I must document all these things on my little Sony Cybershot. I put it in a cellophane transparent envelope, and I would go around taking pictures while, I get the nurse or while I was operating on these patients. Now, in an effort to decode what is helpful, what is not, what works, what does not work, we wrote this book. For example, there was a lot of confusion about ivermectin. There are people who are passionately for ivermectin, and there are those who do not believe in ivermectin. I believe in ivermectin. I myself have taken it any number of times. Whenever I've been exposed, I've given it to patients and they have improved dramatically. However, the book that we have written, Challenges in the Pandemic, a multidisciplinary approach, published by Cheema Publishers, is written in a non-biased, non-controversial manner, in a mainline way, so that people who still wish to follow our guidelines can do so safely and effectively. Now, the challenges that we faced was, I used to do an operation called a tracheotomy. A tracheotomy was where we do a small operation on the person's windpipe, put in a tube, and connect the person to the ventilator to help them to breathe. Now, it was thought that at that time, the person who does this operation will get a major blast of the viral particles and get infected himself. So we devised a method in which to do it literally under 1 minute. So we, before the other procedure where we take a major cut, would take at least 10 to 15 minutes. And all of us had this PPE, and the air conditioner was turned off, and we had to wear triple gloves. So our sensation was we could not feel properly. So we devised this method of doing this operation to help the person breathe, where we could do it safely under 1 minute. I did over 100 of these operations safely, and I've documented in this book. And none of the staff who assisted me before the surgery got infected.
Oh, good.
So we devised a protocol as to how to do it. First, there were a lot of surgeons were afraid. They said, don't do it immediately, do it after 3 weeks or 4 weeks. But there were one group of surgeons said, no, do it immediately. So when we compared both groups, the one on whom we did it immediately and one on whom we delayed, we found the ones that on whom we had done it almost immediately benefited far more. Their stay in the hospital was shorter, they got cured of the virus faster, and that they did not infect anybody else. And the mortality that was associated was far less than the one in which we delayed. So immediately the lesson was clear that we should do it at the earliest. So we had many such challenges like this, again in telemedicine, how to inform the relatives and the loved ones that your family member is doing well or not doing well. The hardest task, of course, to tell people that your family member is not doing well and that death is possibly imminent. Now the thing is that those family members were quarantined, so they could not come out of the house, and this family member was passing away. Now how do we deal with the situation where there's a lot of grief involved in a compassionate way and an empathetic way? So at that time we expose ourselves as we are human. So by telling them, yes, we feel really bad, we are sorry, we share your grief, and let us make arrangements so that you know that your beloved one's body is being taken to the crematorium, and so a person whom we designated, so that the relatives and beloved ones at home would know that the body of their beloved one was taken care of in a respectful way, performing whatever religious rites we could in a compassionate and respectful way, and then making arrangements for them to collect the ashes and do the other things. So these were a lot of things that we had to face, which in many ways were non-medical, but we had to transcend that into saying, how can we be cold clinicians, say, okay, your relative has passed away and that's it. So we had to come out of ourselves as doctors and become human and tell those people in a compassionate way that, look, this is what has happened, we're doing our best, we share your grief, and we are just continue to struggle in this pandemic. All of us were struggling. It's not that any particular person was not struggling. There were a lot of people who had financial problems. So our mantra was, just because we are suffering financially should not make us blind to somebody else who's suffering financially. So very often I let go of my professional fees. He said the person doesn't have money, that's okay. So you just take this medicine and get well. We want you to get well. At such a time, we have to say things like that because to express solidarity with that person. It cannot be heartless and cold and just say, I'm only a COVID warrior. You have to step out of that and say, look, I share your grief. Let me see how I can help you at this time of your bereavement.
So salute to Dr. Chris D'Souza, during this pandemic period when the entire world was shaken with that particular disease, and it's as what we say, a service to humanity is a service to and God, somewhere the professionalism, somewhere the decision making, whether you have to operate or not to operate. Now in this book, Challenges in the Pandemic, which covers the holistic approach of the challenges what Dr. Chris have gone through by keeping his personal emotions and the professionalism intact, and also helping in the process to the needy person at large. I'm sure doctor like Chris D'Souza, I'm sure if those doctors are there, can transform the society, and this is what I think, that's the reason we are saying is one of the best ENT surgeon and a kind-hearted person. So thanks a lot for sharing your experience and challenges in the pandemic, and the entire country owe a lot to the doctors as a warrior, and in your case you have gone out from the comfort zone, understood what the emotions of the human beings are all about, and went and helped those patients by letting your fees off. So that's a great services what you have done during that tough time. I'm sure God is there, will give you in abundance. Thank you very much for.
Thank you, sir. Thank you.